So, welcome again, you guys, to Totally Unmuted. So, today we have a wonderful guest. I'm super excited to have this conversation today. And the reason is because May is Maternal Mental Health Month. And I get tongue tied when I say this, but with Maternal Mental Health Month, it's something that I feel like is something like mental health is not something that is really talked about a lot, and just me with my background being in mental health, and of course us all being moms, and just being a voice for the women. We are the voice, totally unmuted, for the everyday women. And I feel like we need to have more conversations about the things that really affect us every day as women, every day as moms. And so I couldn't have anyone else other than Jensine Speed.
Thank you, girl. Thank you.
You were actually supposed to be at the Investor Fest.
Yes.
I said Investor Fest at the Investor Summit, and I think you had to go out of town. But I'm really excited to have you here today, just to talk about a topic that is so needed. I know that you've been in the mental health space for over 15 years. You've been doing a lot of community work. You've been doing a lot of postpartum support, the perinatal support, just really helping moms in terms of their, mental health. And so I want you to just talk to us a little bit about who you are, more about what you do, and then let's just dive into the conversation. And then also our lovely co-host.
Give it up.
Miss, wait, I was gonna say Tatiana, but that's gonna make everyone call you Tatiana.
Okay.
So Miss Titania.
Titania. Titanic, drop the C, add an A.
Okay, girl, I got it.
I like that.
We not about to be no Jack and Rose, okay?
All right. Yeah. No, because you're right. We're not gonna be there because we both gonna get on that.
Oh yeah, we gonna girl. No, we definitely are.
Survive and thrive.
Right.
Yeah.
We gonna survive and thrive. Like we want to help with the post part of the
Right.
That's what that's about. Helping
That's
the
what we're
women
gonna do.
survive
That's
and
what we're
thrive.
gonna do, baby.
As a mom, that part.
Yeah, seriously.
Yeah. So, just a little bit about me. I think my life's work is like problem solving. That's why I became a social worker, and I'm contributing to problem solving this big issue of maternal mental health. It's real, y'all. It's really huge. And I don't think it's talked a lot about, like the good, the bad, the ugly. You know, we watch TV, we watch movies, and it seems like motherhood is easy. Like I talk to my mom and my aunties, and I'm like, why didn't y'all tell me this stuff is hard?
Exactly.
This sucks sometimes. So I think just having that real conversation is important, because I feel like moms, we have to always have it put together and make it look like we always know the answer, and that's not the reality. That's not my reality. And most moms that I know, friends,
I don't think it's reality.
Yeah, it's not, and the standards are too hard. So this is just my contribution to help moms out there. But as I'm helping moms, I'm healing and helping myself, because I was impacted by having postpartum anxiety after the birth of my second son. And
so I want to stop you right there, not to cut you
off.
So the postpartum anxiety,
get out of my head,
is different from postpartum depression.
Yes.
Okay,
yes.
Like
because I caught that she said that too.
I'm like, okay, so that's a.
And it's actually more common. It's just not as diagnosed as much. And so, we can talk about the difference and stuff like that, but anxiety, it's more or less the racing thoughts, feeling like you're worried, feeling like these intrusive thoughts, like, oh, I'm not a good mom. And, just saying all these different things to yourself, and then you begin to act it out, right? And so postpartum depression is more or less, you've been feeling kind of a low mood. You're not doing a whole lot of your activities you normally would. Maybe you're not eating as well as you should. You're sleeping a lot. Just all these different things. So if you think about anxiety, somebody who's kind of like up here, depression is kind of like you're down here, right?
Okay.
So they're just to kind of make it simplify it.
Yeah.
But yeah, so it's you can see both, and a lot of moms will most times have both. Yeah. And that's okay. And so we work together. We try to figure out what is your norm, where's your baseline, and you can kind of find out a lot of this stuff is kind of rooted in their upbringing, and trauma and things like that. So we have to, yes, they're coming to see me about maternal mental health issues, But if we're really being honest,
Kinda
we're
work
digging
on-
into the
Yeah,
childhood
we work
stuff.
into- because
Unpacking a lot.
I do feel like that type of stuff goes hand in hand, because it's kind of like you cannot compartmentalize your childhood trauma from being a mother too, because all of that is wrapped up into like your hormonal situation of just having a baby with the postpartum depression and the anxiety.
I'm glad you said it.
Yeah. It kind of like expand, like it amplifies it a little bit, when you think about it. But what I was thinking about was, as I was researching more about like postpartum and just more about the maternal mental health side of everything, I didn't see a lot of statistics about postpartum anxiety. Now, I saw the statistics about postpartum depression and the fact that it does affect, 1 in 7 women. And then I thought about for Black women, we are Black women, we Black and we proud, but you don't see a lot of statistics out there that actually have the support that Black women actually need when it comes to the postpartum thing, also. So what I wanted to find out was, I heard you say the difference of the postpartum and the depression. But what I wanted to know was, when you don't, like, let's say you see a lot now with the moms having multiple kids, and moms are now taking their children's lives and then also taking their own lives. So would that be an after effect of the anxiety, or would that be an after effect of the depression?
It can kind of be both. And so that term that you guys are referring to is called psychosis. And that's usually when a mother she's really no longer in her reality, right? She's hallucinating a lot of times.
What makes a mom go into psychosis?
Okay, yeah, several things. Lack of sleep.
Really?
Yes, that can happen.
I do know.
If you've been up for like days at a time, poor nutrition, maybe you're not eating a whole lot, and it can also be environment. Maybe you don't have the help,
Really?
Maybe there's no partner, husband, mother, just any of that, right? Because think about it, like as moms, if we wouldn't have had help, you're going to be up, right? You're having to make bottles or even breastfeed, all of that, change diapers, keep yourself together. And then we can add in economics, money. So if I don't have a whole lot of resources. Right? Or insurance, like it's a whole stuff.
I'm glad that you brought that point out, because I was going to ask, is there any like contributing factors that can make the postpartum depression last longer or elevate it? And I guess I was going to ask, what would be the elevated thing that would take postpartum in a different direction, and that's the psychosis part of it.
Yes, really.
So that's really the more extreme form, and that's what's always talked about in the news. And it really bothers me, because a lot of times people are like, oh, that mother, what's wrong with her? Like, they just talk so
matter of fact, in a sense.
Yes.
Especially for a woman who has been a mother, and maybe they have not been your experience, but you know that it is hard. Like the getting up, every few hours, especially like if you're nursing or you're trying to nurse, or if you are a nursing mother and you have a partner and you may be nursing alone, then so you're solely responsible for getting up every few hours with the baby.
And don't talk about the moms that experience domestic abuse.
Exactly. That's a whole other layer.
Or two, you dealing with a partner who is jealous of the baby because they're used to getting the attention. So I can see that being a contributing factor too. Because some men are really like, well, you doing this with the baby and you doing that with the baby, and what about me?
Right.
You know, I'm like,
what do you mean? Like, we've been half on this baby.
Right. But it happens, and I know I see it even with toddler age children, teenage age children, because as a mother, you know that's a big part of your identity, and you have to do a lot for the child. And so you don't have the support, because sometimes people think not having the support is being by yourself, but sometimes you can not have the support and you can have a person be there.
So okay. So I kind of wanted to talk about this really back in for a second. So it's postpartum anxiety, then it's postpartum depression, and then you can go then extreme version, then you can go into psychosis, right?
Yes, and that's like you have to have multiple factors a lot of times.
What about time frames? Like, is there a time frame that for each stage? And this is only just because, you know, I can remember just from my one of my situations, right? I can remember going into postpartum well, I guess it was anxiety, because I could remember my doctor saying if it had been longer than 10 days, then I would have needed to get a little bit of, you know, further help, you know, but I was like a teenager also, and I was going through domestic violence also. So, you know, that was another thing that probably was a big contributor to that, but I didn't go longer than that. But I can say this, and the reason why I'm saying this is because if it's not checked, right? If postpartum anxiety is not checked and postpartum depression is not checked, what does it turn into long term?
It turns into poor quality of life. It turns into it can turn to other medical and health issues, right? It can also turn to not connecting and bonding with your child, your baby, because you're not present with yourself. So we know that attachment period is really important for that the mother baby bond. You know, a lot of times after delivery, now the normal practice is
they don't wipe their baby.
Yes, put the baby on the chest, right?
Yeah.
Like that's important, right? But if you're feeling, because you start to connect,
the skin
to skin, yes, and there's actual hormones that are being released between you and the mom and the baby, and so there's a myriad of things that it can affect. So it doesn't necessarily. I'm not saying that it'll always result into psychosis. No, that's like there's so many other layers and things going on. But I would say the rule of thumb that we as professionals typically use is that baby blues is when your mood is kind of low because your hormones are depleting. Because when we're pregnant, we have so many of the feel-good hormones. We just like, we're not high. But as soon as the baby leaves, you know, we've delivered or whatever the case may be, those hormones, we start crashing. And then if you're pregnant, you have lactin, which is another hormone. If you're breastfeeding, lactin is the hormone that you're releasing. And so it's just all these different things, right? But we don't talk about this stuff.
Okay, so I want to know.
Yeah, that's the milk hormone that's released.
And what does that contribute to?
It also just affects our mood. It's a chemical imbalance.
Wow.
And so mothers who are breastfeeding, because you know some moms they choose not to, and that's okay, right?
Yeah.
That's one of the conversation. But they are going to, so if you're breast or chest feeding for like 6 months, you can expect your hormones to kind of be imbalanced for those 6 months.
That's good for your daughter.
I was just gonna say that because my granddaughter is 6 months, and her levels, and when I say levels, I mean her mood is kind of like up and down.
Yeah.
And so like I can't wait for her to watch this to see, and like, because even with the postpartum anxiety, it makes sense because I feel like that's what she experienced, because she experienced am I a good mother? My reaction wasn't like how she was like, my reaction was not like how I thought it was going to be. I wasn't excited to when they showed me her. She was like, I didn't get any feels. Because you know, like you have like, you know, when you're pregnant, you like, I'm going to be this, I'm going to be this way. Yeah. And so when it didn't happen, she just was like, she told me, she was like, I don't know. I was like, I didn't cry. I was like, well, everybody don't cry.
Cry.
They're like, you're this on TV. You know, Candace cried. Right. You know, my sister, she's just a little dramatic, but I love her though. You know, I was like, so that may not be the experience.
Yeah.
But I was like, you're concerned about your baby. I was like, so you're showing the signs to me that you're a good mother. You know, like you're like, you know, like the watching their chest go up and down. You know, like getting up every second. Like, so I was like, you showing the signs, so you're okay. But she just was like, she didn't understand, and she thought, and it didn't last that long, as you say, because the anxiety part of it, or I guess like the baby blues, it doesn't last that long. But what is the lactate? What's the
the lactate.
The lactate. That makes sense because she's nursing, and she's solely nursed, and then she pumps too. But that makes sense on why her mood is up and down.
Yeah.
Okay. So man, it's just so many like.
I know, it's so good because
it's all interconnected.
Yeah.
So how long because she plans to nurse for the full year. So how is that going to like still continue to be that way until she?
I think if she can develop different, so like she's what you're describing is intrusive thoughts, because she's saying how about her, she's kind of critiquing her motherhood, her style of motherhood.
Is that normal for moms, new moms to do that?
It is normal. It is normal, but there are certain things that as mental health therapists, we can help them with trying to, one, validate that those feelings, those thoughts are normal, right?
So like, let's just say, Jensine, that I was that new mom, like I'm her daughter.
Yeah.
What is one of the ways that you would validate that for me? If I'm like, you know what, I'm terrible. I'm a shitty mom, you know, because I don't. My baby doesn't even want to latch, because that really happens.
I let my baby fall off the bed.
Well, I'll be like,
now why you let that baby fall off the bed?
I'm just saying, because babies roll off the bed. You know what I'm saying? Like, you know, you be like, oh my God, I'm not watching my kid. I let my kid roll off the bed.
So a lot of times when that happens, I have heard that. I'm just like, look, I have experienced that. And you're not a shitty mom.
Yeah.
Breastfeeding hurts.
Yeah.
It's not easy.
Yeah.
You know, and some moms just don't want to do it. And, you know, you're bleeding, your breasts are engorged, they're cracking. So, no, it hurts. You stopped breastfeeding because it hurt. It was bringing you pain.
Yes.
And so it was better for you and the baby to not do that than to continue.
Yeah.
And so then I just kind of look at where these thoughts are coming from. Like, hey, who's telling you you're a shitty mom? Is your mother-in-law, your mama, your man? Where are these coming from? Are they right? Or are they coming from you? Like, let's explore, and then I'll just say, okay, well, what did your baby eat? Yeah, she ate. Did you change the diaper?
Is she full fed and healthy?
Like those things, like your basic needs.
Yes.
Right. So if you're meeting the basic needs, to me, you're not a shitty mom.
Yeah.
And so, of course, we'll get into more detail.
Right, but no, that was good though, because sometimes people really do feel like that just based off of those things. And I know, like, you just have to reel it back in sometimes, because when you do have those intrusive thoughts, they will really get the best of you. Like, for real. They'll have you sitting there looking in the mirror thinking you a slum bag, and you're not, you know?
I want to ask you, with the postpartum depression, and like you were saying earlier in the conversation about childhood traumas,
that's
sometimes
so good,
being like a contributing factor to postpartum depression or anxiety. Do you think that you could be predisposed, like maybe given your history or your mental health, to having postpartum depression or postpartum anxiety?
I never knew that.
Yes, so if you've already had, like, maybe in your adolescence, you experienced maybe your parents got divorced, right? Or one of your parents were incarcerated. That is trauma, right? That's happened to you. You've experienced it. And so you are likely going to, I don't want to say likely, but you're more prone to having a mental health condition in your pregnancy. You can be. Yes, they are. There's a
like even teens that are experiencing pregnancy, domestic violence,
all of those things. Really. And if we think about teen pregnancy, like, they are such a unique group because they're shunned from society a lot of times, right? Some families want to hide the pregnancy, or, you know, just all these different things. The community does not embrace them. So that's another thing, like, oh, well, this thing that happened to me, it's not accepted. Like, I don't want to, you know, like, so you can imagine the intrusive thoughts that they're having. Like,
or some of the girls who are dealing with teen pregnancy and they haven't told anyone, you know, like they haven't gone to a doctor, they're not getting any like medical help, so they're like hiding their pregnancy. No one knows they're pregnant, and so they're dealing with those emotions on their own. So
that affects the baby and the baby's development and the growth and all these different things. So it's a lot.
How can go ahead.
As me, as a mother, I know a little bit, but for a mother who may not be familiar with the signs, what are some of the signs that a person who is in the home with a person who just maybe had a baby to look for, to maybe, like, sometimes you don't
That's a good question.
Thank
you for stealing my question.
Everybody's thinking like that.
So I would say looking at their hygiene. Okay, so looking at
their hygiene would be a good, really?
Well, because they're not. Yes. So like you're not showering, not going to shower, and things like that, right? These are what we call activities, normal daily activities of living that they would particularly do, and they're not doing them. So eating is not normal as they should, you know, as it once was. Lack of sleep, not wanting to do some of the fun activities that they normally would. Of course, there's a period, you know, after you give birth. You
that's what I was going to say,
After you've done that, right?
Yeah. But so maybe like
a
about
later, right?
a month
so
later.
I would say a month. So the clinical definition, 2 weeks. I'm looking at, okay, the first 2 weeks, if you're kind of reporting to me like I'm feeling this low mood, I'm like, okay, that's baby blues. But if it's happening 2 weeks and beyond, then there's other stuff going on.
Yeah.
So like if you can look around their house, the dishes are piling up, the clothes are piling up, they just kind of look unkept, right?
Yeah.
And that's, I mean, and I'm not.
We know that you're not. But it's really something important for people to be able to, because sometimes you can live in the home with someone and literally they are suffering in silence and you don't know. Yeah. So that's why I think it's really good to say that, like, you know, are they taking care of themselves? You know, like, I think that's basically what you're saying. Like, if this person is not taking care of themselves, and this can be your spouse. You know, I mean, that's something
or a friend. If I'm visiting my friend and she's, you know, had a baby.
Exactly.
And I think that's where the support system comes in. That's like when we talked about earlier, like not having the help. Right. And they can kind of like, I guess, contribute to the length of the postpartum. You know, like coming in like, okay, you the dishes piling up. Let me wash the dishes for you.
Right.
And like do like a check-in.
Like, offering some help and things like that too.
Check on your newly born
friend. Because
a
lot of times too, that's something that you do get a lot is when you are pregnant and then you have the baby. People always check on the baby, but they'll never say, "Girl, how you doing?" Like, you know, and things like that. And I think that's
everybody's like, oh, they'll do anything for the pregnant person.
Yeah.
Go get your crawfish and go get your cravings, but as soon as you drop it, they'll pass right by you. Don't speak to them.
And it's like, well, what about me? You know, what about me? Like, I need help too. Let me ask this too, because I think this is important too. We talked about like finances earlier, and I just think it's so important too for women to know how to advocate for themselves. You know, especially like in healthcare situations and medical, you know, practices and things like that. How can women start to advocate for themselves? Because a lot of times, you know, people don't want to listen to us. You know, they don't want to listen. And I don't want to just say just us, but it's the truth. We know as Black women, when it comes to our health care, people don't want to listen to us.
Especially in maternal.
And that's what I'm saying. You see it a lot more. And maybe people are going to say, that's just because that's what y'all want to see. No, you see a lot of us. It may not be all us that are, you know, necessarily doing hurtful things to our kids, but we're suffering in silence. And so for that being said, like, how can we advocate for ourselves in those healthcare spaces to where we can really get the help that we need, so that those, you know, generational traumas that we are predisposing our children and things like that to, we can start to kind of like navigate through that.
I think it's really important for you to get to know the social worker of that unit, because social workers are the ones that are going to connect you, and they by nature, we're advocates. My background is social work. We're advocates, right? And we don't always do what is popular, you know, because that person's going to speak on your behalf. And I also say document. Get the name of the doctor. Put the time and the date. You can even have somebody, a family member, a friend, come sit with you and also help, you know, have these difficult conversations and be a witness. You know, try not to go to the hospital by yourself. Bring that girlfriend with you. I see this a lot, and especially lower income moms, Black moms who have Medicaid. A lot of times because they can't go. I was just them. Say that.
Yeah.
So the social. Okay, so you're telling me, because I mean, well, it has been. I'm not gonna say how long since I've had a baby.
Look, don't feel bad. I'm right behind.
So there is a social worker that is connected to the unit of the hospital.
What is it called? It's the prenatal ward, right? Is that it? Okay.
So so the social worker is. What is the role of the social worker? Because when I think social worker in maternity ward, I think
they're gonna take the baby.
Yes, that's what I'm thinking. I'm thinking like, are we drug testing? Because that's when you only hear of the social worker in
and that was probably when we were having. Because I think a lot of things too, you know, within the last, I'm gonna say, what would you say? Maybe like 10 years. I'm gonna say 10 plus years, right?
10 is a safe number.
10, that's a safe You know, it has changed when we had, so that's what I'm saying. Your kids, Jensine, how old are your kids? They're like
7, 4, and 19 months.
Okay, so that's what I'm saying.
Okay.
So,
You
I'm a little newbie in there.
But I mean, 7. You still have been through enough stages.
Yeah, that's what I'm saying.
Yes,
so that's why I'm saying, like, they probably do have a little bit more support when it comes to the mental health on the prenatal ward.
And so, like, social workers, they're there, how they operate, they're there to provide resources, right?
Okay.
So it's like case management for that mom. So if they know that, okay, this mom, she's showing sign of postpartum depression, she has Medicaid, these particular therapists don't necessarily accept their Medicaid. Let me see, there's some other organizations, right? So a wonderful organization that I'm on the board of, Conscious Moms, we provide free therapy for moms throughout the state of Louisiana.
They do.
Yes.
We're going to plug it in. Yes. And I know, look. And they are good, and they do, and they do it at Family Road. They do it at Family Road.
I'm just really.
We can actually volunteer. We need to go volunteer. I actually did volunteer
because I told her earlier I was a fake therapist.
So
now I'm gonna have to add maternal.
To my bill. Do that.
Add it to my bill. But I'm really like. I'm just excited though, and to have this information be out there, because sometimes you don't know where to start. I didn't even know up until meeting you and getting this information that they had like maternal mental health. Because you know postpartum, and you know that it's an issue, and we talk about it, but you don't know that it's an actual,
like, it's a specialty.
It's a real thing.
Right.
I mean, I don't want to say a real thing, but it is.
But I'm saying, like, you can go to a specialist that solely focuses on, because you think about the different types of counseling and therapies that they have, and that's just not one that's popular that you think of to go. So you may not think that, I'm dealing with this and I have to deal with it alone. That it's someone that can actually help me, and she specializes in this particular thing. So I don't have to feel like I'm going to be unheard.
And it's important that moms seek out a perinatal mental health therapist / maternal mental health therapist, because some therapists who are not trained in this discipline, if they see a mom like, I want to throw, like, the mom may have some scary thoughts, right? Intrusive thoughts, and say, you know what? I just want to throw the baby across the wall. That does not mean the mother's going to do that. Right? So we're trained to, like, dig a little deeper, kind of explore. Whereas the untrained therapists, even though they have background in mental health,
try to put
they may say, you know what, 911, you have to go to.
And DCFS, baby, she don't need that baby.
The other side of the social workers gonna come in there where you like,
but and that's like you're creating this other trauma, and so we have to take. There are times where I have had to recommend moms to go into an inpatient facility. Right, but that's after a lot of exploration and things like that, where I felt like, yes, you at this state right now, you are a threat to yourself or the baby.
But of course, like you said, it came from exploration. And then I was going to say this too. What about the moms that actually experience like infertility and like stillbirth? Because that's another thing too. There's a cost. There is a cost associated with with grieving and healing. Yes, and
I had forgotten about it. Because I was going to ask her for like women who have abortions or miscarriages.
That too.
Yes,
abortions.
Because I think that you can kind of have like a postpartum thing, like after it as well, like I guess from the hormones. Because is that a thing?
So that is very much a thing. Yes. So that is post-traumatic stress. Again,
so
abortion.
Event. So having can I just specify really quickly? So having like an abortion, a miscarriage, stillbirth, or would infertility be included in that too? Having post. Yes, it is.
Yes, all of it. Yes, because as women, we are conditioned at a very early age. Let's get married. Let's have a baby. I want to be pregnant. But that's not a lot of moms. A lot of women's. That's not their story, right?
Yeah, and in this day and age, a lot of women are like, I just want to have fun with my husband right now. We'll do the baby thing later.
Right.
That baby thing, we're going to do that baby thing later.
And so there's a lot of grief. Like I've had a good number of clients who experience loss, and it's sad. It's really sad. But they're in the right place, because I'm able to just allow them to feel how they want to feel. To be what they want to be, because they feel like if I say this to my friend or my mom or whomever,
they're gonna be looking at me
they're just like, you can hear and get over it. That's harmful.
As black folks, girl, you just need to pray. And y'all know I love my God. You know what I'm saying?
Yes.
But sometimes you need additional help.
Yes, you really do. And I think
therapy and prayer can coexist.
Yes,
it can. And as it should. As it should. You know, your spiritual, yes, it is. Your spiritual health definitely.
They do.
Yeah, it does.
So some things you do need the additional help. And I'm glad that the maternal mental health aspect of it is a specialty, and I don't have to, when I go in there and tell that lady, look, that baby was crying and I just wanted to leave that baby in that bed and just go on by my business and lock the door.
Right. So when I hear that, that's like, okay, you're like, exhausted.
Right.
And I'm looking like, oh, okay, so who's in the home that can help you? Like, there's all these other questions that are coming to my head. Like, I'm never gonna think like you're an unfit mom. Right. You're not capable.
Right.
That's the last
and that's
thing.
One of the things that I was gonna ask too. Is like women that have kids now that they can't afford to like take care of. Right. You know, how are they affected, and like what resources do they have? Because for those women too, because they're going through a lot of mental health things too.
And it's the financial
yes, because it's like all I have is government assistance. You know what I'm saying? And it's like we know government assistance just keeps you. It's like they keep their foot right on your neck because you can't do too much.
Oh no.
Then you know, but then at the end of the day, it's like also sometimes, you know, you have women that have multiples on top of multiples, you know, so like what resources do they have out there for those women?
There are different nonprofits locally that are around that have like specialized in just family, women type issues, things like that, programming. Right?
Okay, programming, that's good, yeah.
And so they're also to help them not be so dependent on the system. So moving from a place from dependency to empowerment.
Yes,
but also
that's
let
good.
me
Oh my God,
teach you skills.
Dependency to empowerment.
But it's skills, right? Because like it might be, you know what, you can actually work, but you may not have job interviewing skills. You may not have clothing to go for the interview. So it's looking at some of the other underlying issues as to, I'll say this. I think most women want to work. I really do believe that. But if you don't have the social supports to kind of do,
I would say I have a passion for what I do.
but what, you don't want to work, friend?
No, I mean, you know.
Oh, because I was about to say, we ain't talking, we're not talking about you, we're talking about the other women.
Yeah, I know.
But like, so just giving them the skills, giving them the confidence to be able to say, you know what, okay, I can better my life. And just having that, sometimes you need that person kind of hold your hand temporarily. Yeah. Until you get to a place where it's like, you know what, I no longer need that. And that's okay.
And I think that's good because I think a lot of times I don't want to say the government because I don't want to be the person who's like, oh, the government. But I think they put a Band-Aid on a lot of things instead of really digging deep to really, you know, to really find the issue, but also provide support. Yeah. Because you can't just say, like you said, all women just don't want to. We don't want to not. We don't want to sit here and just.
You want to provide.
Even if you
don't want to work.
Even if you don't, social media gonna make you feel like you want to.
You want to provide for your kids. Is what I'm saying. Like, so if I mean, majority of the time, legally, that's what you're gonna have to do to provide for your child, which is work, and you don't feel good as a mother when you can't. Your baby need diapers, you know what I mean? And so if you are already in a space of having the postpartum anxiety or postpartum depression, and you're dealing with the financial aspect of it, and you know you're lacking resources, that is something that can contribute to the longevity. Because what is the worst case scenario of how long does postpartum depression last or can last?
Oh, it can last if it never goes untreated. Like I've work with women who have teenagers. Wow. And yes, teenagers. They come in with me. They come to see me for other reasons, but the teenagers. So I'll kind of do a look back. Okay, so tell me about your pregnancy of your 13-year-old, and we can find trauma, different things. Yes. We can connect the dots to kind of show like why they're kind of stuck in this period. They never got the help that they needed when that newborn was there.
It's almost like going back to heal your inner child. Like in a sense, that is really true in therapy. I remember just one of those, it's not really like an exploration, but one of those things that when you're learning, when you're doing like clinical when you're in a clinical field or whatever, they actually make you do things like that, because you really do, because you'll be surprised how many times you actually go back and you find how so many traumas are connected. And the reason why they can't heal from trauma 9 is because they've never healed from trauma 3.
They're stuck.
I get that and understand it, but I don't know, I'm totally like shocked that postpartum could last. I thought you were gonna say like maybe 2 years.
No, I mean, I think clinically that's the term, but I don't.
It probably just turns, to me, I thought about it, just turns into like regular depression or thing. That's what I originally thought. That's why when I was talking to you earlier, I was like, I want to really find that out. I just thought it turns into adult depression or things like that. It
just goes undiagnosed.
But because I think about a case in. She wasn't an African American. This was years ago, and she had postpartum, and she murdered her 4 kids. But she had the kids maybe like 1 to 2 years apart. So she never.
Oh yeah.
She never.
And she probably never. She never realized she had it.
Right. I'm saying, but she never like healed from like having it. So if you're a person that have multiple kids. Like now that you say it, like it can't. It makes sense, and
it just kind of piles up.
And if it's untreated, and you've had multiple kids, 4, 8, 10 kids, that's that's a lot.
You know something, y'all, that I'm sitting here thinking about that I wanted to, before we wrap, go back on, is when you talked about the resources for moms out there, just as a whole. Just because I think when I was young, I did go to like Family Road, because Family Road has been around for a long time. And I'm actually, to be honest about it, I think it's a beautiful thing to have an organization like that that's still there, because I just know for me, I didn't have a lot of support, and, I wish now that when I look back, I would never, ever, and this is just my truth. That has been one of the reasons why I've never wanted to do that again. I just being a mom is beautiful. It is, but it's messy. Is sometimes it can be very exhausting, and it can be very hard for you, especially when you don't have the support. And so the fact that like now, like I know about Family Road, there's other organizations out there that's really pouring into women, teaching them job skills, teaching them how to go from dependency to empowerment. I think that is so important, because me being a teenage mom, not having the support, coming from a family that we barely know how to navigate just being family, less known, trying to support each other in ways like that. I think that is so important. And I think women really they need to know about these resources. They need to know that you don't have to be dependent on government assistance for the rest of your life. That it may be a transitional period, but you can really have whatever it is in this world that you desire, but you just got to be able to plug in. So with that being said, y'all, we gonna wrap on that. But before we wrap, this is like the favorite part where we call it sound on, and this is where each person just leaves the audience with something that each woman can kind of like keep in their back pocket. It can be just something that you want to just leave with someone, like a quote, something maybe like from today, but just anything that you can say, girl, put this in your back pocket and turn the sound on, because we not muted over here. We totally unmuted.
Okay, I like that. Yes. Ooh, that's a good one. I would say trust your instincts. God gives us instincts, especially women, for a reason. And if you feel like you're not right, like trust that, and go with it, and let people know that you aren't okay, and it's okay. I know it's cliche. It's okay to say you're not okay, but it's real. Trust your instincts.
Yeah, that's good.
Okay, I like that.
That's good. You got anything you want to say?
Yes.
Titania?
Yes. I would like to say that because I really feel full, and I didn't think that I was going to feel full, because I don't plan on having no kids, so I ain't gonna need no maternal mental health situation going on. But
girl,
it's people that care.
Yeah,
and you may not feel like.
I know. I'm kind of like emotional right now.
I feel like it's people that care. You don't. You may feel alone because you don't have the resources and the knowledge, but you are not alone, and you do actually have people that care. You have Miss Speed over here.
Yes, and seriously,
big time.
conscious moms. We have my mommy, my baby. Sia, Health. Who else? There's so many other ones out there. Family Road.
And
that
sure,
one. That's another one. Yeah, we're gonna plug everyone in. Yeah. So I really appreciate, like, this was a really good conversation, and I thank you so much.
Yes, I'm like, girl, no, it's postpartum anxiety.
That's what you're gonna say, friend.
Yes, so you know I gotta let people. You know I'm a therapist. You know I gotta let people know.
Let them know.
Well, I got to outsource the other part. You know.
Yeah, please.
Once I tell them I got to outsource
because you're not clinical.
I'm not a clinical.
Well, you're the first step.
Yeah,
you're the first step. Seriously, because people come to talk to you all, and we literally let our hair down.
And you gave me the tools.
Yes.
To know what it is.
There you
Thank
go.
you. I appreciate it.
All right, y'all. Well, thank you guys for tuning in to another episode of Totally Unmuted. Keep laughing, keep loving, and of course, keep leaping.
Okay. I love that.